And next we'll move on to cardiac tumors. So the most common cardiac tumor, if they generally ask like that, it is going to be metastasis. Cardiac tumors are not that common. If they say it's the most common tumor, it will be metastasis. And what metastasis? Most commonly from lung carcinoma. So lung carcinoma mets will be the most common kind of cause of metastasis. But if they ask about the primary tumor in heart, and if it is a benign tumor, so if it's a child, it is going to be a rhabdomyoma, while if it's an adult, it is going to be a myxoma. However, if they ask what is the most common primary malignant tumor, so in malignant, if they ask in a child, it is going to be rhabdomyosarcoma. In adult, it will be an angiosarcoma. And in heart valves, as such, the most common tumor will be a papillary fibroelastic. We'll be just seeing about 2 tumors in detail. Rest all we'll not discuss. So they are not important also. So myxoma is the most common tumor, most common benign tumor of the heart, primary benign tumor of the heart, which we see in adults. So here, the most common location of this will be in a left atrium at the location of the fossa ovale. And on microscopically, if you see, there will be presence of some stellate kind of cells called as lepidic cells, which are present in a myxoid stroma. So as the name suggests, myxoma stands for myxomatous matrix. So in a myxoid stroma, we are going to see some kind of stellate cells which are called as lepidic cells. And this myxoma is going to be associated with Carcinoid syndrome. So Carcinoid syndrome is a triad of this various myxomas present both cardiac and extracardiac locations. So other than that, we can also have endocrine abnormalities and skin pigmentation. This is the classical triad of Carcinoid syndrome. And it is going to be associated with GNAS1 mutation. And if you remember, GNAS1 mutation is also the mutation which is seen in McCune-Albright syndrome. In McCune-Albright, again, you have endocrine abnormalities and the patient will be obese. So that again can present with GNAS1 mutations. Then you have the next tumor, which will be rhabdomyoma. Rhabdomyoma was the most common primary benign tumor in a child, and the location of this will be ventricles. And here you see spider cells. So spider cells are nothing but, if this is the cell and this is the center, from the center, if you see, there will be some kind of thread-like material which is originating from the center and radiating towards the periphery. So it looks like a spider web like. So these are called as spider cells. And here it is going to be associated with tuberous sclerosis. Tuberous sclerosis, it is a neurocutaneous syndrome. Here you will have various features like shagreen patches, ash leaf macules, various hematomas and various tumors. Like in a kidney, you can see angiomyolipoma. In heart, you can see rhabdomyoma, or other than that, you can see various other glial tumors as well. So here the mutations associated will be TSC1 and TSC2. So TSC stands for tuberous sclerosis. So tuberous sclerosis 1 and 2 mutations will be present on in rhabdomyoma as well. Next, we'll see about some of the miscellaneous features, things about cardiovascular system. So starting with carcinoid syndrome. So carcinoid tumors are usually known to produce certain substances like 5-hydroxytryptamine and serotonin. And most commonly, carcinoid tumors are common in the lung and GIT. That we all know, right? So if these 5-hydroxytryptamine and serotonin are being elaborated, they will cause some systemic manifestations, and that is called as carcinoid syndrome. So normally it will produce flushing, diarrhea, headache as well. But in heart, it can produce certain symptoms, and that is what we are going to see now. In heart, it is usually going to cause right heart symptoms. Right heart especially, that is tricuspid regurgitation is the feature which we see in carcinoid syndrome in a heart. Why right heart is being involved? Because when the GIT or GIT is the most common site, right? So carcinoid produced 5-serotonin released by this GI carcinoids will enter the portal vein and come into the right atrium. So from right atrium, it is going into right ventricle, and from right ventricle, it will go into pulmonary artery and enter the pulmonary circulation. So in pulmonary circulation, it is actually going to be metabolized. So the serotonin is going to be metabolized in the lung itself. So when it reaches from the lungs into the left atrium, there is not going to be any 5-hydroxytryptamine left to cause any syndrome. So that is why left heart is usually not affected. It is the right heart which is affected in carcinoid syndrome. But it can be affected, left heart can be affected in certain conditions, especially when there is going to be a septal defect. Suppose there was a septal defect, so whatever 5-hydroxytryptamine was present in the right atrium is going to enter into the left heart also. So that way, left heart can also be affected. Other than that, if there is going to be lung carcinoid, so carcinoid which is present in the lung, So there, if it is produced, this serotonin which is being produced in large amounts, they can all of it cannot be metabolized by the lung. So that again can cause a left heart syndrome. Okay. Next, lastly, in cardiovascular system, we'll be seeing about mitral valve prolapse. So mitral valve prolapse is also called as a Barlow syndrome or a floppy valve syndrome. It is just a degenerative condition, and on microscopy also, if you see, there will be myxomatous degeneration of this mitral valve, and the most common presentation of these patients will be asymptomatic. They don't have any symptoms. Only on auscultation they present with a mid systolic click. Okay, mid systolic click is kind of characteristic for a mitral valve prolapse. So we have seen about cardiovascular system till now.